Hi, my name's Phil. I like talking about politics, and this week an alternative SAGE group conducted a very public discussion amongst a number of experts, scientists, public health experts, and to go through the process of discussing various things and putting forward recommendations for the government in how to act for the coronavirus pandemic. And what I'm going to do in this video is to discuss what they said about clinical care. But first, if you'd like to be notified of daily news and politics, then please subscribe to the channel and click the bell notification icon. So yeah, in many ways it was quite wide-ranging, and I don't want to go on forever, so I'm going to pick on particular topics to discuss. There is a link to the actual broadcast in the description below if you'd like to watch the whole thing yourself. It went on for well over 2 hours. But on the clinical care front, there were some very, very interesting insights, some of which I absolutely did not know myself. And what the expert was saying here was that the lockdown had clearly helped the NHS. Remember that the government slogan, stay at home, protect the NHS, save lives. And you can have all sorts of arguments about whether that's the right way to do things, but at the same time, nonetheless, it has helped ease pressure on the NHS. However, the concern now amongst clinicians is twofold, really, I suppose. One is staff health and well-being. Now, at the moment, and it's not just in the papers, you know, the papers going on, oh, NHS heroes, absolutely fantastic, above and beyond. It's actually true. At the moment, NHS staff are working harder than they normally would. They are up against it. The pressure is immense. And you would be able to appreciate this. There'll be some times when in your normal work, I mean, some of you may be medics, of course, but for others, in your normal line of work, where there's just certain times when it's all hands to the pump and you just have to, everyone has to step up. And then after that time, you get to relax a bit. It goes into your normal pattern. But there comes a point where if it doesn't ever ease that pressure on you, you're going to break. There's going to be a cost, a physical cost or a mental cost. And this is a big factor for the NHS staff going forward. They cannot sustain the current levels of activity indefinitely because NHS staff right now are burning themselves out, particularly in key hotspots. The other thing is that in terms of critical care, the issue is that without the staff, we don't have critical care. This was the key thing that came out. And the staff needed for critical care are highly trained. Remember the Nightingale hospitals that they're starting to mothball now? Well, or at least in London. I mean, the reason why they didn't have patients, ultimately, is because they were never going to be able to have patients for all the beds there because they don't have the staff. The critical care staff, it's all right building more places and putting more beds in. I thought that was fantastic. But if you don't have the staff to treat the patients, then the beds are useless. They're just beds. You can't put patients in them. There's no nurses. And so you can't create these places overnight. And what this person was saying, which was absolutely astounding to me, so they know they're going to need more critical care doctors and nurses. So the government have put on about 100 training places to skill up some critical care doctors, but none at all for nurses. So we're not actually going to gain any more critical care nurses. And that has huge implications for easing the lockdown, because if we risk, you know, infection rates going up, we're not even building towards getting more staff to be able to deal with this. So what they were saying is we've already started from a low point, because bear in mind, we did, you know, the NHS was not in a fit state even before this crisis. I was reporting that last year before even I knew this was coming. And so we started from a low point. But the government have not put anything in place to improve it. We're certainly not going to get to the point where we're going to be able to cope with this. And part of the reason, she was saying, that critical care in the NHS has coped so far, and she didn't mention, by the way, that they were turning a lot of people away and telling them to die at home. Part of the reason why critical care in the NHS has coped, she said, is because it has been supported by non-critical care staff who weren't doing their normal roles, because that's another thing to bear in mind. Doctors and nurses who would normally be treating people for other things haven't been doing that. That's a problem waiting. So what the government needs to do is to look at how the NHS is going to cope as those staff go back to their normal roles. So you've got this compounding issue. You've got NHS staff are already working above and beyond and cannot sustain that level of activity, burnout risk. And then you've got the fact that the critical care at the moment isn't going to be enough, but it's been supplemented by people seconded from other areas who are going to have to go back to those other areas. And you're just putting on 100 extra places to train up and skill up 100 critical care doctors, but no nurses. And what about getting more in? You know, we're already not been training enough, well, certainly not nurses, but training is tricky at the moment as well with all the measures going on. And also it was said that after natural disasters, it is known that mortality rates increase further down the line, and it's tied to various things. It can be tied to higher anxiety as well as restricted medical services, and that's what we've got now. In order to provide the critical care that's been needed, we've had to restrict other medical services. And someone gave the example of Welsh data showing that heart attack hospital deaths are down. But people haven't stopped having heart attacks just because of the pandemic. So the mortality has been shifted away to homes. And on the issue of adherence, you know, adhering to the guidelines, it was said that as some measures become different as the lockdown is eased, because at the moment everyone is essentially treated the same. Everyone's in it together. Yes, there's a lot of people increasingly breaking the lockdown measures, but by and large the population has been fully seized of them. You know, all the evidence is that the majority of people are following the rules and understand them, and we're all in it together type attitude is holding some sort of societal cohesion. But as you ease measures, inevitably there's going to be some people who start to get a bit more freedom and others who do not, because it's going to be based on need for the economy and you know, essential services. And there could be a perception of unfairness which will lead to resentment if the easing is not managed very carefully by the government from a policy point of view and being communicated very clearly to the public. So it's a good job we have a government who are very careful about what they do and think things through and communicate effectively with the public, isn't it? Yes. Because and this is the fact of the matter, some parts of the population are going to come out of lockdown effectively before us. In fact, some people already are, because some people have to go to work. They work in shops, or if they work in the NHS, or they work in power stations. There's lots of key work going on. And so those people already have more variety in their life than the people who are trapped at home, whether it's working from home or whether it's furloughed at home. And, you know, in terms of easing the lockdown, there was a little discussion about, do you carry out trials in different areas? You know, rather than just doing it nationally, would it be better maybe to do it in little areas and see what happens, so that if it turns out to have been too early, and you know, you could easily make a genuine mistake. I mean, Germany, for example, eased a few lockdown measures, saw their R value go up a bit, and it's like, it was still below 1, thank God, but you know, went up a bit. So you do that, and when you're going to look at things on a local level, the trick is, how do you keep it local? Because, you know, if you do open it up in a little trial area first, how do you keep those people local so they don't bugger off to another area where it hasn't opened those lockdown measures? So the real risk is in terms of the local response, because so far Boris Johnson's government has been characterised by centralisation. So we'd have to do the opposite. We'd have to invest in local services. You know, because if we ease the lockdown too early, even if it's unwitting, we allow the virus to spread to regions where it hasn't really bitten yet, because it's not homogenous throughout the country. There are certain regions of this country that have not really been hit very hard by it, and you risk having those areas hit by it. So the local response, they were saying, is absolutely key to this. And it was noted that this will require significant resources. The government is going to have to spend for this. But someone very cheekily did note that it wouldn't actually cost as much as all the ventilators we ordered that didn't work, or the tests that we ordered that didn't work, or the Nightingale hospitals that we didn't bother to fill with staff or patients. So as you could probably guess, this particular person, who is known as Alison Pollock, who's a public health consultant and a former director of the Institute for Health and Society, who made the statement, was not really a fan of the government. In fact, she had a proper lashing at them at several points. And I did feel sorry for there was someone who was trying to counter her, someone by the name of Professor Martin McKee, who kept trying to bring people out of political discussions. Bless him. His argument was, yes, we're in a right old mess. Yes, okay, it's political, but the focus needs to be on where we go from here. It doesn't have to be political. And as much of a political beast as I am, and, you know, as much as I agree with everyone bemoaning past and current policies, making a proper arse of our response, I was inclined to agree with McKee on this one. The danger of sneaking politics into the discussion is that some people will attack it for that. It was supposed to be, well, it was a discussion of the science. But as soon as you start even talking about policy and therefore politics, then at that point some people will say, oh, all biased, which, you know, could potentially undermine it. So even though there's no doubt that the same discussions will have been taking place in the actual SAGE group, we're not allowed to see those discussions, so people will imagine otherwise. And again, I'll make the point that members of this panel have also been members of SAGE. Not all of them, but a number of them, including the chair, who was a former chair of SAGE as well for some years. This isn't the scientific equivalent of Dad's Army. They are experts in their field. They are of the same quality. They are people who would ordinarily be on the SAGE panel right now if only government political appointments weren't occupying so many places on it. That being said, the point was being made that the decisions made now by government will determine where we are in 3 years' time as we're coming out of the crisis. So it is absolutely crucial that the government make the right decisions right now. They can't save the situation from poor decisions made in the past, but if they don't make the right decisions right now, for whatever reason, pride or blinkered views or whatever, then in the future we're also going to be in a position where we can't catch up. And there was then a final warning that I thought was, you know, in terms of clinical care, I would argue, about amplifiers. So putting lots of people together and the infection spreads like wildfire. And it was said, for example, we've seen it on cruise liners. We know that this is happening. And there was a suspicion on the part of at least one member of the panel that this will now be happening in hospitals. And I absolutely would agree with that. And just my own comments here, as an educator, I would then think to myself, so yeah, we've seen it happen on cruise liners. There's a strong suspicion it will be happening in hospitals. What happens when you start opening schools again as well? But there you go. I'll leave it there until I pick on another topic for tomorrow possibly as well. Let me know what you think in the comments below. I hope you found the video interesting. If you did, don't forget to click the like button. If you'd like to support the channel further, then please also click the Patreon link for details. And until next time, I'll see you later.